Hey everyone, welcome back. Today I thought we could discuss or kind of circle back to a concept or a few concepts we've discussed on the podcast in the past, how your gut impacts your thyroid health, and really the fairly substantial impact these two have on one another. But I'd say mostly the influence flows from the gut to the thyroid, including thyroid nutrients, the impact of immune function and autoimmunity, and also if you're on medication, the ability to consistently absorb that medication. And this is a term that we've published on. I don't want to say we've coined it, but the gut nutrient thyroid axis is certainly something that we work a lot with, and we're trying to put out there more of our findings. And so I wanted to share a few of these and kind of tie together, again, the gut, its impact on key nutrient absorption, how that impacts symptoms, thyroid function, thyroid autoimmunity, and then dovetail into a discussion on these two different gut types. And this partially reconciles why some people may notice they kind of thrive on maybe a lower carb, higher fiber and vegetable diet, whereas that will flare other people. And conversely, some people do well on a lower vegetable, perhaps higher starch diet. And these two gut types, bacterial versus fungal, helps reconcile this and gives us some direction with what we can do dietarily. The first piece here I wanted to kind of put on the board, if you will, is something I came across with working with Laura. She was on medication, thyroid medication, with her endocrinologist, and the dosing seemed to be sufficient because her levels were normal, yet she was still complaining of joint pain, fatigue, insomnia, and weight gain. And it may not be too uncommon of a clustering of symptoms for someone with hypothyroidism who's on medication to be complaining about. My labs are normal. I don't feel well. What do I do? She came to see me and us at the clinic, knowing that we had this focus on gut health, wondering if there was a component of this that could help her thyroid, or at least these symptoms. And what happened in Laura's case, and sort of the concept that really hit me in working with her, was she saw improvements in her weight gain, in her joint pain, in her fatigue, and in her sleep. While simultaneously, her endocrinologist who was monitoring her said, you don't need as much thyroid hormone. And during the course of all of those symptoms improving, she was able to cut her thyroid hormone dose literally in half. And so the concept here that hit me was people can be malabsorbing their thyroid hormone medication, and if we improve their gut health, they may need a sizable dose reduction while simultaneously seeing a number of symptoms improve. As more and more people started coming to work with the clinic for gut health, we were continually seeing this crosstalk, if you will, to the thyroid, to the point where it was just so common that we published a 6-part case series sort of sharing our findings about, hey, improve gut health. And these seemingly challenging thyroid cases will oftentimes sort themselves out. And this is what we published in the IMCJ, Integrative Medicine, a Clinician's Journal. And then we did a follow-up publication in the journal Nutrients in affiliation with Christy Adamo, who is at U Maryland Medical, going a little bit further and talking about the connection between this gut and nutrient thyroid axis. And the main points here that I want to make you aware of, one, gut health, sort of really high level, impacts thyroid health. But the components of that would be thyroid hormone medication absorption. The second one would be via improving gut health, you can reduce inflammation and therefore symptoms, remembering that 70% of your immune system is contained in your intestinal tract, and the immune system uses inflammation as one of the main instruments to perform its function of cleaning things up. So if we're thinking leaky gut, then we're thinking increased inflammation. And some of these symptoms that Laura and others were experiencing or do experience are really inflammatory, and they may not be from the thyroid hormone or the thyroid gland in and of itself. Third point is you can have a improvement in thyroid autoimmunity. This hasn't been super robustly demonstrated, but there's at least, I think, an initial signal. As one example, we discussed maybe a year plus ago, this interesting Polish study that found people with SIBO, small intestinal bacterial overgrowth, did have a modestly higher level of TPO antibodies than healthy controls without SIBO. And another Italian paper that found treatment of H. pylori reduced thyroid antibodies. Other studies haven't reinforced that, so it's kind of mixed in terms of what you find, but nevertheless, I don't think it's hard to justify improving one's gut health in attempts to improve autoimmunity, including thyroid autoimmunity. And then the fourth point here is the absorption of key nutrients. Selenium and myo-inositol can help with thyroid autoimmunity, and they can help to prevent or correct sluggish thyroid, or what's known technically as subclinical hypothyroid. This is where you have a mild elevation of the TSH. Those nutrients don't tend to be malabsorbed, but they're just important to think about. Iodine, I put iodine on the notes here because there was one study from a couple of years back that found people who were adhering to, in the long term, a paleo diet had increased risk of iodine insufficiency. Now, long term, I believe, was defined as a year or longer. And what I suspect is happening here is that people who are going on what I think is a generally healthy diet, the paleo diet, are inadvertently cutting out sources of iodine fortification. Salt, if people are consuming sea salt rather than iodized salt, sea salt is going to be much lower in iodine content than an iodized salt. And then if people are not consuming dairy and grain products, these are also fortified. So what could be happening is people are not getting enough iodine in their diet. And this could be as simple as doing either a Google search for the foods that you commonly eat, or plugging your data into an app like MyFitnessPal or Chronometer, and just running a report on, are you hitting your required iodine intake? The nutrients that are really associated with malabsorption specifically are iron and the B vitamins, most namely but not limited to B12. And this is because a subset of people with hypothyroid will also have impaired secretion of stomach acid, and that acid is needed to ionize iron and B12 and absorb it, or also the release of intrinsic factor for B12 is required. But nevertheless, low iron or low B12 can be part of what's happening nutritionally that could lead to these non-responsive symptoms, especially fatigue. Iron is fairly easy to assess via a ferritin test, and B12 is actually a little less straightforward in terms of serum B12 or urinary or blood, what's known as MMA, methylmalonic acid, don't always seem to catch individuals who benefit or require B12 supplementation. So I kind of favor trialing B12 for a month and seeing if you notice a consistent and appreciable improvement in symptoms like fatigue, but not limited to fatigue. And by the way, if this has been helpful, please comment, subscribe, and if you wouldn't mind, share this with one person that you think it may help. This does so much to allow us to reach and get helpful information in front of more people, so I would really appreciate that. So then, coming back to Laura, what if Laura never improved her gut health? Chances are she might start going down this other therapeutic avenue of, well, let's up your dose, or let's say you're on levothyroxine, let's try adding a T3 to that, or let's just go to a desiccated, something like Armour or NP thyroid that's going to combine T4 and T3. She would likely not see improvements in her symptoms by doing that. In fact, that's part of what we encapsulated in that 6-part case series, how our clinical team with various individuals had tried different approaches of medications and were just never able to get resolution of symptoms or stabilization of the TSH until we started using gut interventions. In fact, one of the case studies by Dr. Mather showed a really nice normalization of the TSH after undergoing a few gut interventions like antimicrobials and probiotics. Now, what if someone with symptoms similar to Laura was given thyroid hormone because her doctor didn't know what else to do? maybe there was some sluggishness detected, or maybe the clinician, the doctor was saying, gosh, I'm a clinician, I want to help. You're not hypothyroid, you're having symptoms. Why don't we just try thyroid hormone? And this is what leads us to this very important number, 37.2. This number is a derivative of a meta-analysis that looked at 17 trials, summarizing over 1,100 patients' experience. And what they found was 37.2% of individuals who were on thyroid hormone could stop the hormone. They maintained normal thyroid levels, meaning their glands actually worked, and they had no change in their symptoms. So said more simply, perhaps 1 in 3 are on thyroid hormone that don't need it. And this is what can happen when someone is given thyroid hormone sort of too loosely, or when given for sluggish thyroid. I feel in attempts to help the individual, but the really sad thing about this is twofold. One, numerous studies have looked at this. Well, maybe someone with sluggish thyroid will improve from thyroid hormone. And fairly consistently across multiple trials that have looked at this in earnest, these studies have demonstrated that people with sluggish thyroid do not see symptomatic improvements from going on thyroid hormone. This ties into the, I think, more dire finding, which is once people start on thyroid hormone, it's uncommon for another doctor to check if they actually needed it. So it's assumed when you see the next clinician that you work with, oh, I see you're on thyroid hormone medication. You must have been correctly diagnosed as hypothyroid. And what can happen is for years and years and years, people can be on thyroid hormone that they don't actually need. Now, coming back to this meta-analysis, one of the, I think, empowering and hopeful findings was the length of time someone was on thyroid hormone did not predict their success in coming off of the hormone. So length of time on medication did not influence successful ability to discontinue. And how you can double check this is looking at, if you can locate them, the labs that diagnosed you as hypothyroid from before you started on the medication. Once you're on the medication, you can't assess the gland's function. You need to look at the labs from before. And this brings us to what I felt to be a wonderful conversation with Dr. Antonio Bianco. He's the former president of the American Thyroid Association. And the reason why I feel this podcast conversation has over 100,000 views is because people are starved for a balanced perspective on this. And even Bianco admits during the conversation that as an endocrinologist, sometimes he feels pressure or patients feel disgruntled when he won't give them thyroid hormone, when he sort of has a conversation that, listen, you're not hypothyroid and you likely won't benefit from hormone. But if people are reading what I feel is probably well-intentioned, but sometimes, for lack of a more tactful term, sort of sloppy messaging on this, every symptom means hypothyroid. And it's a little bit sort of fear-mongering-ish. People reading those blogs or listening to those podcasts are suffering and looking for answers. So then they go to their endocrinologist, sort of expecting to be put on hormone. And some endocrinologists, because I think all doctors are trying to help people, will acquiesce, put the person on the hormone. And that's how, in part, we get to that 37.2% of people, 1 in 3, on medication that don't need it. And all the while kind of looking past what could be driving their symptoms and their suffering, their gut health. The first thing that we want to do is rule out hypothyroid, because if someone is hypothyroid, then they will benefit from medication and they should be on it. And this is where I think conventional medicine and the conventional lab guidelines are actually correct. TSH between 0.45 and 4.5, and free T4 between 0.8 and 1.8. And unless you're seeing TSH that is high paired with a T4 that is low, according to these ranges, you don't fit the diagnostic criteria for hypothyroid. Therefore, you very likely will not benefit from thyroid hormone replacement therapy. And there's one caveat here, which is, let's say everything is normal other than your TSH is 5, 6, 7. You still probably should not go on hormone. Why? The majority of these people will see their TSH normalize if they did nothing else. Thankfully, other research has shown that the use of vitamin D, selenium at 83 micrograms per day, and myo-inositol at 600 milligrams per day has been shown to increase the likelihood that TSH will normalize. And this also has an effect on thyroid autoimmunity. So all this to say, you should be careful at this crossroads not to too quickly go on the hormone, especially if you're sluggish thyroid, again, because there's been adequate research interrogating this question. These people don't benefit symptomatically, and sadly, they end up being, in many cases, on this hormone lifelong because people aren't checking the original diagnosis. Taking a step back, whether you're hypothyroid or not, you still want to improve your gut health because this can help with autoimmunity. If you are on medication, this can help with absorption, and it can help with the symptoms that are sometimes labeled thyroid symptoms, but they're really sort of this vague, broad grouping of inflammatory symptoms: fatigue, brain fog, insomnia, joint pain, just to name a few. And potentially even something like thinning hair, especially if you're malabsorbing certain key nutrients. And so then coming to this gut typing concept I opened with, what I've been noticing is these gut types tend to bifurcate into either a bacterial type. Here we're thinking either SIBO, small intestinal bacterial overgrowth, or IBS, versus a candidal or a fungal overgrowth type. And why this has so much relevancy, for a few reasons, but perhaps most importantly, is the diets are quite different. The SIBO and IBS patients, they tend to do well on starches, things like white rice, white potato. Those foods tend to flare the fungal types. Now, some of you may have done a SIBO breath test and said, boy, the prep diet for before the test, which is essentially white rice and meat, I felt great on. That's your sort of classical bacterial SIBO IBS type. You do that in a fungal type individual, and this can definitely flare their symptoms because the starches feed fungus, but they don't feed bacteria. Now, conversely, the bacterial types, if you put them on a little bit lower or more moderate of a starch and carb diet, but higher in vegetables and prebiotics. So we're thinking here asparagus, broccoli, onions, garlic, cauliflower. Fungal types will do really well on this, and bacterial types tend to flare. So this really helps, at least in my view, reconcile how we fine-tune the diet. There's always going to be this commonality of fresh, minimally processed, definitely avoiding ultra-processed foods. But then there's a few nuances in terms of how we steer selection, mainly of vegetables, starches, and fruits. As we've discussed in prior episodes, with Candida, it is a normal resident of the gastrointestinal and even nasopharyngeal and vaginal tracts, but under conditions of stress, poor sleep, high alcohol consumption, a high degree of antibiotic use, now the Candida can function as what's known as an opportunist and start overgrowing. When the healthy factors aren't present, putting pressure against the fungus will overgrow opportunistically. And part of what then happens is they generate these filaments or hyphae that burrow down into tissue, kind of anchoring them, making them more difficult to treat, but also via that anchoring, they produce an inflammatory and immune response. And this might be why we see non-digestive symptoms associated to fungal overgrowth. We had also covered in the past what I found to be one really fascinating study that correlated prior Candida diagnosis with a diagnosis of chronic fatigue syndrome, also with mood issues like anxiety or depression, and gastrointestinal symptoms, most namely would be looser bowels and bloating as compared to constipation. So the looser bowels and the frequency is more demonstrative of a fungal overgrowth. And then carb cravings. And with the carb cravings, sometimes when we say cravings, one might picture this ravenous desire for sugars and sweets and things like that. But it can be more subtle. And I say this as someone who's experienced this. It can be I just don't feel satisfied, let's say after dinner, unless I have something sweet or starchy. I've consumed enough food throughout the day, so it's not a true hunger. It's just this nagging, I want some chocolate, I want something sweet, and I just don't feel satisfied until I have that. That shouldn't happen. Now, if you're under eating, you're going to crave food, but this is more of a subtle, I'm adequately fed, but I still don't feel satisfied until I have that thing. Thrush, or a whiteness of the tongue, and then yeast infections. This can be armpit rashing, jock itch, vaginal yeast infection, these are all, or even toenail fungus, I should also add, are all symptoms demonstrative of, or at least increasing your risk of, a fungal overgrowth and being this sort of fungal type gut. Risk factors: antibiotics, PPIs, contraceptives, a Western diet, which is a risk factor for many things, stress, and older age. And the diet is a Candida diet, which is lower glycemic index, glycemic load. We have developed a Candida diet because there's a few key things in terms of you don't have to be definitionally low carb. And that can be problematic, kind of shoehorning everyone into a low carb diet. That can help for Candida, but for some people, they won't sleep well, they'll have brain fog, they'll have fatigue. Women may have thinning hair or eventually develop amenorrhea, lack of cycling, if they go too low carb for too long. So we were really judicious in our construction of the Candida diet to make sure we didn't sort of throw all the carbs of the bathwater out with the baby. And assessment here, you can look at a combination of stool, urine, and antibodies. None of these, in my view, are perfect, and they should always be secondary to the primary analysis, if you will, which is someone's history and their symptoms. And also then going forward, the response to something like a Candida diet. And we do have a Candida diet for those of you who wanted the deeper dive. Essentially, the difference or the guidelines for a Candida diet are you're going to focus on lower glycemic foods. So berries and apples as compared to something like bananas and mangoes. Bananas and mangoes, too high sugar, too lower fiber. Broccoli, whole potatoes, brown rice, all good. Avoid white rice, white bread, potato chips due to the processing and due to the sort of higher glycemic index or load. And then also avoiding processed meats. Then coming over to the bacterial gut type, there's definitely some overlap here. Abdominal pain, bloating, and gas. This is where you can have diarrhea or constipation. You can also have fatigue and mood issues. You can have prior risk factors of antibiotic use, post-infectious IBS, or you had a bout of food poisoning, traveler's diarrhea, which that acute episode cleared, but in the wake of that, you had these symptoms that just didn't fully go away. That's a hallmark of what's known as post-infectious IBS and the bacterial type. The low FODMAP diet is what works really well for these individuals in terms of limiting broccoli, limiting some of these sort of healthy, lower glycemic foods. You're going to limit asparagus, broccoli, cauliflower, garlic, and onions, and focus on things like kale, spinach, carrots, and you can have these more carb-laden foods because they're not feeding of the bacteria and therefore they're okay. So said as simply as possible, bacterial overgrowth individuals, bacterial type people want to avoid really high fiber and high prebiotic foods because they feed bacteria, not forever, but as part of this shorter term rehab and corrective plan. Regarding testing, a SIBO breath test, there are some issues with some of the testing, but it at least gets you in the ballpark. Most namely, the lactulose test does have a fairly significant risk of false positives. So it's something to be factored in when interpreting a lactulose SIBO breath test. Or if you have an IBS diagnosis, either one of these are demonstrative of a bacterial type. And again, the low FODMAP diet is really what you'd want to be looking at if you suspect you are a bacterial type. And taking a little step back, when you either try a Candida diet or a low FODMAP diet, you should notice an improvement within the first week or two. And by the second or third week, if you're not improving, then I would try the other diet and really look as your biofeedback response to be the primary way you gauge if this is the right dietary approach for you. So the good news is it doesn't take long to figure this out. And then regarding supplements, as you may know, I'm a big fan of probiotics as evidenced by the research that's being published. Numerous clinical trials are teaching us that probiotics are antifungal, anti-SIBO, helpful for IBS, they're pro-motility, they're anti-leaky gut, and they're also anti-inflammatory. The nice thing about probiotics specifically is they help either gut type. Are they a cure-all? Will they help everyone, everywhere, all the time? No, but this would be a very, I think, important second step to consider after diet, or could even be done conjunctively along with whatever diet you're going to try. The other thing about probiotics that I find important, insightful, helpful is this way in which they influence the gut, brain, adrenal connection. This first paper by Alex Ford and colleagues, and Alex Ford was on the podcast a while back discussing various therapeutics for IBS or the bacterial type guts. They found that administration of probiotics helped to correct the activity of the limbic system in your brain, specifically the center known as the hippocampus. They did these functional MRI brain scans pre and post probiotic intervention. And after taking the probiotics, they demonstrated clearly that there was a normalization of limbic system activity, which governs in part fear, in part memory, and has an impact on inflammation in the people who took probiotics, whereas there was no benefit demonstrated in the placebo group. So this is the gut to brain limbic system component. Another study by Quigley and colleagues found that administration of probiotics normalized what's known as the cortisol awakening response. The cortisol awakening response is looking at how much cortisol you produce in the morning. And this is where you should have a fairly robust output of cortisol. This gives you the I'm up, I have energy, I have mental clarity, I'm ready to sort of get on with my day. In people with IBS and with fatigue, that normal output of cortisol is blunted. And what Quigley showed was when administering a probiotic, there was normalization. And on the graph you're seeing, at week 0, there's low cortisol output. Then at week 4 and week 8, you see a normalization of cortisol output. Then the subjects stop taking the probiotics, and you see over the next 2 months, the cortisol levels kind of go back to this aberrant or low, insufficient output, probably telling us that the 2 months on the probiotics was not a sufficient course to fully correct the issue. But nevertheless, the point still stands that these people had improvements in mood, energy, and also IBS symptoms that correlated with normalization of cortisol output. So how all this ties together is the gut impacts the limbic system, remembering that the limbic system includes the hypothalamus, and the hypothalamus is what tells the adrenals to produce adrenal hormone. And this is how we tie all of this together. The gut impacts the limbic system, which includes the hypothalamus. The hypothalamus signals to the adrenals, and you need normal adrenal output to have normal energy and also mood. And we've also discussed this evidence-based meta-protocol for which we're currently working on a paper to publish in a peer-reviewed medical journal that sort of makes a scientific case for these usage guidelines. 3 types of probiotics, blends of lactobacillus and bifidobacterium. This is your traditional type, at a dose from anywhere between 1 and 50 billion CFU per day. Or you could use Saccharomyces, either as Boulardii or Cerevisiae, at a dose of between 10 and 15 billion or 4 to 8 billion respectively. Or A soil-based probiotic, this is normally one or a few species of bacillus at a dose between 2 and 6 billion CFU per day. And the minimum duration we would advise is between 2 and 3 months, remembering that Quigley study that stopped at 2 months and then saw a regression, notating other studies that have found for certain metabolic, certain mood, and also for constipation syndromes that you may not see full response until 2, 3 months, or maybe even a little bit longer. You should see, in my opinion here, some indication that the probiotics are working probably within the first 1, 2, or 3 weeks, but you don't want to stop a therapy too soon because this opens the door or increases the likelihood that you could have a regression. So you'll have a sense early on, but then you want to ride out the protocol to at least 2 or 3 months. Garlic, we've also discussed what I found to be a fascinating study that administered 500 milligrams 3 times per day of garlic as a capsule supplement. And this was as effective as the drug fluconazole for vaginal candida. A different study found that when the antifungal drug, I believe in this case it was nystatin, was combined with a candida diet, the clearance of candida went from about 40%, technically 42%. When combined with diet, went up to 85%. So hence the power of combining the right diet along with some type of natural medicine. And then alternatively for the bacterial types, there's many herbs that have been shown effective for SIBO. This data that you're seeing here with the graph is our data from years ago that we've finally sort of analyzed, crunched some numbers, and it's currently in peer review, and we're hoping it'll be published within the next few months. We tried 2 different approaches for natural herbal treatment of SIBO, and they both worked about equally as well, getting us to roughly a 40% clearance rate of SIBO. So to sort of summate all this, a healthy gut indicates or can lead to a healthy thyroid. It's not the only thing, but I would argue it's quite important. 2, consider checking your iron and your B12 levels. 3, make sure to double check your diagnosis. Don't do anything without checking in with a healthcare provider first, but remember that fairly alarming stat that about 1 in 3 are on thyroid hormone they don't need and should be able to discontinue without any changes in their symptoms. Again, check in with your healthcare provider before you change anything, but that is really important to bear in mind. The 4th point, determine your gut type and eat accordingly, because coming back to Laura's case, if improving one's gut health can lead to a halving of the thyroid dose and a resolution of the chronic symptoms that she was suffering with, one of the tools that can help enhance the effectiveness of your diet would be determining what diet your specific gut type requires. And then 5th, consider trialing first a probiotic, and depending on how that goes, you can layer on top of that either garlic or a blend of herbals that are antibacterial for SIBO or bacterial overgrowth. And the final point I wanted to leave you with from Darwin, which I really appreciate this quote, ignorance more frequently begets confidence than it does knowledge. One of the things that I've noticed and I find disheartening is that some healthcare providers, and certainly it seems Instagram and Google and YouTube, their algorithms favor really sort of strong and opinionated and almost alarmist titling or topics. The downside about that is it favors for people who have very strong opinions. And as a clinician, I can say working with people is one of the most humbling things that you can do, because it exposes, let's say I was very staunch about the paleo diet. Well, if I'm listening to patients, eventually I'm going to start seeing that while that does work for some people, it doesn't work for others. And so it sort of bridles your confidence and makes you a little bit more nuanced. So if you are listening to or reading someone's work, keep this in the back of your mind, that if someone seems very, very sort of confident in their conclusions, it could be that there's a degree of ignorance that's fueling that confidence. And I don't mean that in a disparaging way, but it is a principle that I think you can use to help determine who's worth listening to and who might just really have an opinion that they're trying to get out there rather than being a thoughtful and attentive clinician. But in any case, I hope this helps you double check your thyroid diagnosis, get the right thyroid care, and determine your gut type, eat accordingly, and all these things to, most importantly, improve how you're feeling. Alrighty, this is Dr. Ruscio. Please comment, let me know what you think, and I hope this helps.